Are you suffering from cervical spinal stenosis? If your MRI shows C5, C6, or C6, C7 stenosis, the two most common areas of cervical stenosis, what are you doing to take care of this? What stretches are you doing to help improve this? Watch this video. I'm going to show you which stretch you can do to help combat this. My number one stretch. My name is Dr. Alykhan Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. And before we start, I'm going to ask you to like this video. I'm going to ask you to subscribe to this channel, because if you subscribe to this channel, you're going to be informed of more things that you can do to help improve your spinal health, because my game plan is to help you optimize your health. Now, let's start. Cervical spinal stenosis can be similar to lumbar stenosis. Same pathological process, same arthritic changes, same disc degeneration, the same type of ligamentum flavin thickening, but it's now happening in your neck. It's no longer in your lower back. Now, before we start, I want to go over an important safety note. Cervical spinal stenosis is a more neurologically sensitive condition than lumbar. The stretch that I'm going to show you and demonstrate with you today, I would actually encourage you to make sure you review this protocol with your chiropractor or your physician. You make sure the technique is appropriate for your clinical specific presentation. It is important. And if you have balance problems, if you have fine motor difficulties or bilateral hand weakness, then please consult your clinician before attempting this stretch. So let's start. In the cervical spine, the spinal cord is present and not a collection of nerve roots as it would be beyond L1, L2 in the lumbar spine. So you're actually dealing with a spinal cord, and that means that the central canal cervical spine stenosis at at C5, C6, or C6, C7 can compress the spinal cord itself, which can produce serious issues affecting balance dysfunction and hand weakness, hand tingling, dropping of objects, loss of grip strength. Cervical extension, and that's when the head is tilting backward, compresses the spinal canal most severely. For cervical stenosis patients, any sustained cervical extension is a position that I don't always recommend, because that can create more concerns and more issues. Cervical flexion, the chin tucking towards the chest, opens up the cervical canal by spreading the posterior elements apart. So now let's get into the next stretch that I'm going to talk about, and the number one stretch I'm going to talk about, and that is the towel traction technique. And I'm going to show you how to exploit this principle of the chin tuck with regards to distraction. The two most common cervical stenosis levels are C5, C6, and C6, C7. But nerve root compression can be different between them. There are three nerves that go into your arm and your hand, and your symptoms in your hand identify which nerve is affected. Now, let me explain that to you a little further. First, let's talk about your hand. Now, we talk about your hand, we talk about the fingers. So the nerves, there's three nerves that go into your hand. There's the ulnar nerve, the radial nerve, and the median nerve. And when they get into the hand, they start to branch into different fibers, and they hit different areas of the hand. So when somebody comes in and says, I'm getting numbness, tingling in my hand, I know it's not the complete whole hand, even though it may feel that way. It's not that. Specific areas are being affected. So I'll ask them, which areas are being affected? If you're talking ulnar nerve, well, you're talking ulnar nerve, it's going to be this pinky finger and half of this finger here, the fourth finger. Now, when you're talking median nerve is the other half of this finger, and then these two fingers, okay? Now, the hand can also be affected in median nerve too. Then you get into radial nerve. Radial nerve is actually the thumb. So identifying where the sensation is being lost, where the tingling is, where the numbness is, helps us identify which nerves are being affected and which nerves could be affected in the spinal cord too. In the cervical spine, the forward head posture can exist. This is the anterior displacement of the head relative to the shoulders, and this produces an enormous stress on the spine. And here's a newsflash. A majority of the population actually suffers from this. Most cervical stenosis patients have a measurable forward head posture associated with what's going on too. Every centimeter, that forward head posture adds approximately 4 kilograms of compressive load on the cervical spine. Could you imagine that? That every centimeter your head moves forward, you're adding another 4 kilograms of load on your shoulders. With that anatomy established, here is the technique that I want you to understand on how we can combat this. The next stretch is the cervical towel traction. Now, with this cervical towel traction, essentially what you're doing is you're taking a towel. I'm just taking a tea towel because I don't have a large neck. But people that do, you want to use maybe a thicker towel. Now, with that towel, you don't want it too thick. You don't want it covering the whole neck. You just want to be able to place it underneath the base of the skull, which is the occiput here. So underneath this base is where it's going to hook. The most important thing is about this is that this is a great stretch that relieves the intradiscal pressure. So if you've got a disc herniation, this is a good stretch. If you have a cervical spinal stenosis, this is a very important stretch because it helps to relax the ligamentum flavum. It helps to open up that canal, as well as if you've got a cervical radiculopathy, especially a cervical radiculopathy with a cervical spinal stenosis. This is one of the stretches you want to do. So once you rolled up that towel, you're going to place it underneath the occiput. Your arms are going to be elevated. And before you give yourself a little tug, you want to slightly, 10 to 15 degrees, tuck the chin in, okay? So all in one motion. So you're going to hook, okay? Get the arms up, tuck the chin in, and elevate. And then you're holding. And you're holding this traction for anywhere between 20 to 30 seconds. Obviously, if you can't, then you just hold it for as long as you can, and then you work your way up. And then once you're done holding it, you just relax. Easy, simple stretch, cervical traction with the towel. So all 3 elements together, the towel under the occiput from below, hands pulling upward above the shoulders, and the chin slightly tucked for 20 to 30 seconds. 3 sets with a 30-second rest between each set. Performed twice daily, morning and evening. That's your technique. That's your stretch. That's what you should do. And what you should feel is a gentle lengthening of the neck upward. A reduction in the neck and shoulder tension that cervical stenosis patients carry constantly every day. So for many of my patients, particularly those with significant C6 or C7 nerve root involvement, a gradual reduction in the arm and finger tingling during the hold, not immediate complete relief, but a perceivable reduction that confirms that the technique is achieving what it needs to achieve. And that's it. You're looking to see this decompression happening in your spine, and you should start to feel a release, feel a little better. What you should not feel is increased symptoms during the hold, any sharp neck pain, dizziness, or nausea. If you're getting this, then stop. Don't do this. You go consult your chiropractor before attempting this technique again. Towel under the occiput from below. Hands above the shoulders pulling upward. Chin slightly tucked. 20 to 30 seconds, 3 sets, twice daily. It's as simple as that. Now here's what the stretch cannot do, and that is address the structural narrowing of the cervical canal. The disc degeneration at C5, C6, C6, C7 that reduces the disc height if it's existing, and the foraminal dimensions. The osteophyte formation, the bone spurs at the uncovertebral joints and the facet joints that encroach onto the neural foramen. The ligamentum flavum that is thickening, that folds into the cervical canal while you're in extension. These structural realities are part of your life, and they require clinical intervention. This is why I would always recommend chiropractic care with this. You want to be under the care of a chiropractor to ensure that this stretch is something you can do first and foremost, and that it is benefiting you. But also, having that chiropractor doing spinal adjustments, helping with your nervous system and helping to regulate your nervous system is only going to help you get better and get better faster and be able to manage these symptoms. So you think about it, 1 towel, 1 stretch, twice a day, morning and evening, and adding in chiropractic care can be a game changer with the way you start to live your life. So hopefully you found this video educational. I'm going to ask you to share this video with others that could be suffering from this. I'm going to ask you to like this video. I'm going to ask you to subscribe to this channel because I'm going to keep on throwing out more and more content that's going to help educate you. And throw some comments down. I'm always checking the comments. I'm always responding to it. And I'm always here to educate you. My name is Dr. Alykhan Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic Wellness Center. I look forward to seeing you on my next video.